Iowa Live.
From the Carl Chevrolet Studios in West Des Moines, welcome to Iowa Live. I am Lou, and we have a very special guest joining us today because we're talking about knee pain. And of course, knee pain can be caused by all kinds of things. It can be caused by injury, caused by medical conditions, and can affect anybody of any age. And joining us right now, Dr. Josiah Fitzsimmons from Vero Health Center to talk about knee pain. Now, we've talked about injuries and medical conditions. How are these really classified?
Yeah, absolutely. You know, knee issues can happen to so many different Americans. Oftentimes, you know, it's classified from a rupture of their ligament, tendon, ACL, MCL. People hear about those all the time from sports injuries, but really the most common thing that we're seeing is degeneration and arthritis that's occurred over time for so many individuals. You know, they've been active their whole life, they've been having different jobs where they've had to move, maybe they're out on their knees playing with their kids, you know, maybe they just have a slip and fall during the winter, and that wear and tear on the knees over time can really cause deterioration, lots of issues.
Now, what are some of the symptoms that people should really be looking for? We see some of them on the screen here right now.
Yeah, these are great ones. You know, swelling, stiffness, redness, you know, difficult to the touch. Lots of time with the stiffness, you wake up in the morning, you haven't moved, or you sat on the couch for a long time, and you're just like, oh, you know, it's really hard to, you know.
I thought that was just getting old.
Yeah, no, it doesn't have to be, you know. You know, so people, you know, just difficulty with moving around, you know, it's difficult to maybe even go for a walk or get off the couch or just do daily activities. So many people want to get outside with this beautiful weather. You know, I've been trying to spend as much time as I can possibly outside, but I've talked to so many patients that can't enjoy it because it's painful to go outside, just do basic activities, even around the house, you know, or even clean their house, you know, just basic things that they aren't able to do because their knee pain is inhibiting them from doing their regular activities.
Okay, and the knee pain, obviously, and you also mentioned other things you want to look out for too, temperature and coloration too, right?
Yeah, you could have, you know, sensitivity, you know, even to the touch with your knee, you know, arthritis, like I talked about, gout could be very painful, even different infections, all those different things can happen with the knee. But the big one is that arthritis and degeneration of the knee. You should have a nice spacing, you know, in between the bones in your knee, and that can really deteriorate over time, and that's going to cause a lot of that chronic pain. You know, maybe you're just extending your knee and you start having that popping, cracking noise.
Right, yeah. And again, people thought that was just getting old, but that
doesn't have to be.
That doesn't have to be. That is the key thing here. Now, what about the risk factors that are associated with knee pain? If you just let it keep going on and on, what's going to happen?
One of the biggest ones is weight gain, because if you're not active, you're not burning as many calories, you know, you're still eating the same amount of calories, then people are going to start to gain weight, and so that can actually cause deterioration of the joints even faster. Actually, every single pound of weight they have actually applies additional 4 pounds of pressure to your body's joints.
Really?
Right, exactly. So it's going to cause that deterioration even faster. And
so if you've gained 25 pounds, that's putting 100 pounds of pressure on your joints.
Exactly. So they're going to deteriorate at a much, much faster pace. But really, the biggest risk factor with knee pain is decreased quality of life. I mean, you're just not going to be able to do the things that you want to do, whether play with your grandkids, play with your pets, do your daily activities, do your hobbies, travel, all those things. You're just so debilitated, you just say, oh, I don't want to do that today. Okay. Or, oh, I don't feel like doing that. Or, I don't want to go, you know, to the game. Or, you know, you're minimizing your quality and your expression of life.
It's changing how you live.
Exactly.
Yeah, and you don't want that to happen. Now, what can be done about this? How can you treat this?
You know, we actually have an amazing treatment protocol that's actually designed to get to the root cause, actually try and increase that spacing in your knee, improve the blood flow to your knee, and also get everything in proper alignment.
Okay.
And so we really put all those protocols together. It's actually a 4-part treatment protocol. We actually have regenerative protocols that we can utilize as well to actually naturally restore that spacing within your knee joint so that you can have that cushioning like you used to, so that you don't have to have that pain, the popping, cracking, and that you can really just get back to all those daily activities.
Now, if people want to see if this treatment works, you have something very special going on right now, and they can get, am I hearing this right? They can get a free treatment?
Yeah, we've actually never done this before.
Okay, this is brand new.
Yeah, so people, you know, can come in our office that can actually get the initial treatment at no cost, so they actually see people are going to feel immediate relief after one of our treatments.
Just one?
One, yep. And
okay.
So we want people to realize what their life could be better, how much better they could feel. So that's what we're doing.
Okay, now this is worth about what, almost $200, right?
Yeah.
Yeah. And you're offering it for free?
For free, yeah.
Okay.
Come in, get a free treatment, see exactly what's going on. Let's get that space opened up. You're going to walk around right after the treatment, and you're going to say, this is what it used to feel like without knee pain.
How cool is that? I don't know if you can get any better than that. If you want to get a hold of them, folks, you know the number. It's 515-335-VERO. There it is up on the screen, 515-335-VERO. First 20 callers, we need to have you dial in as fast as you can to take advantage of this special at Vero Health Center. This is an amazing offer.
Yeah, so many people have been told they have knee issues, they have to live with it the rest of their life. There's nothing you can do about it. You know, they don't believe there's a solution to get better, okay? And so that's what we want people to say. There is hope, there is a solution. Have a free knee treatment, see exactly how much better you could get. Now, it's obviously not going to get fixed in one individual treatment.
Right.
It takes time. Arthritis degeneration occurs over many years. It's going to take a series of treatments to get you to the full measure of success that you want to get. But after one treatment, you're going to notice improvements, and that's going to give you a glimpse of what's possible, how your life could be improved without knee pain.
Okay. Proof is in the treatment.
Exactly.
That's perfect. Thank you, sir.
Of course.
Great job as always. Don't go anywhere. We'll be right back. This is Iowa Live.